دكتور سمير العنتري، تفضل. موضوع positive correlation between the blood reflex in Schlemm canals and the decrease of intraocular pressure after selective LTB in primary angle glaucoma. تفضل يا سمير.
السلام عليكم، أسعد الله مساءكم جميعا. افتح. لا مش هذا اللي في الملف الأول، المجلد الأول. نفسه بالانجليزي بوزيتيف. تحت بالاشياء. طيب، بسم الله الرحمن الرحيم. موضوعي اليوم عن الcorrelation between blood reflex in Schlemm's canal and the decrease of IOP after selective laser trabeculoplasty in open angle glaucoma. As we all know that open angle glaucoma, the elevated intraocular pressure is the common indicator for the diagnosis and the progression of the disease. And this can be managed by hypotensive medications or laser trabeculoplasty and filtration surgery. And it is well known that in open angle glaucoma, most of the resistance to the aqueous humor outflow located in the trabecular meshwork. And we can find some resistance in Schlemm's canal. So selective laser trabeculoplasty selectively target pigmented trabecular meshwork cells, whereas the resistance is the most in open angle glaucoma. Uses Q-switch frequency double and YAG laser. Here we have a small video. بالله شغل الفيديو لو سمحت. We can see in this video, after applying the laser to the trabecular meshwork, اضغط على السهم يشتغل. اضغط على السهم اللي تحت. ايوه هذا. نكبرها. After applying the laser to the trabecular meshwork, thermal effect can change the tissue of the trabecular meshwork and increase the spaces between the cells. The mechanism how the laser can increase the spaces of the intraocular pressure is not well known, but mostly because of the remodeling of the tissue and the response, the response in the tissue. طيب. Some studies did histopathological pictures. We can see here In this picture, this is before applying the tissue. This is the trabecular meshwork appearance, and that after applying the laser. We can see the spaces between trabecular meshwork cells wide. But the question is, which patient is suitable for the procedure? And because we are targeting the trabecular meshwork, how about the distal outflow system patency? How can we evaluate this? So, blood can be visible in Schlemm's canal on gonioscopy in severe high ocular hypotony or high episcleral venous pressure, or in some compression, if we do compression by the examiner gonio lens on the episcleral veins. And there is a study showed that there are better results in canaloplasty in eyes with good blood reflex into the Schlemm's canal. So here comes the idea of our research, which included 35 eyes of 25 patients, divided into two groups. Negative groups showed no blood reflex, and positive groups with good blood reflex. We used Hague Street Goldman 3 mirrors lens. Schlemm's canal blood reflex was recorded as quadrants, 4 quadrants: superior, inferior, lateral, and nasal. All the patients received single session of 360 standard SLT. Baseline IOP was around 20 millimeter mercury. The success was defined as IOP reduction of 20% or more at 3 months after the procedure. The subjects continue with the same lowering treatment to avoid spikes of high intraocular pressure. Prescribed branoprofen eye drops for 5 days, and asked to return in 1 week, 1, 3, 6 months after the procedure. As a result, we can see first, SLT causes an obvious decrease in IOP in all the subjects. But greater decrease in IOP was noted in the eyes with blood reflex in Schlemm's canal. And there was a positive correlation between the number of quadrants with blood reflex and the IOP decrease after SLT, as we can see at 6 months and 3 months here. At 6 months, the IOP was not significantly different from the baseline IOP in the negative group, but the positive group continued to have a good decrease in IOP. So, among all the studies published about SLT, IOP reduction ranged from 18 to 40% from baseline, with success rate of 59 to 73. In the current study, the total success rate was 61%, but was higher in eyes with blood reflex, comparing with eyes without blood reflex. About this method has been established and stated in the previous studies to be a good method in inducing and visualization of the stasis of the Schlemm canals and distal pathways. And we can assume that from a pathophysiological viewpoint, it is highly likely narrowing or even collapse of Schlemm's canal. It's not a result of increased intraocular pressure, but it may itself contribute to the reduction of aqueous humor outflow, resulting in increased IOP in open-angle glaucoma. And this can be demonstrated in gonioscopy as blood filling defects in Schlemm's canal. With eyes, if there is lack of reflex blood in Schlemm's canal, this can indicate complete canal collapse in open-angle glaucoma. This has been stated and discussed in previous studies. In our study, we can assume that the patency of Schlemm's canal and distal outflow components determines its function. And of course, the blood reflex, it is the opposite of the natural direction of aqueous humor outflow. but it can indicate that there are no collapse present in the canal, or at least there are no adhesions between the inner wall and outer wall of Schlemm's canal and the distal pathways of its patent. So this can lead to significant IOP reduction, particularly in eyes with complete circumferential filling. In conclusion, we concluded that observing blood reflex in Schlemm's canal during routine gonioscopy can help identifying patients who are most likely to benefit from the procedure and can give good indications of the Schlemm's canal and distal outflow facilities function status. Of course, this study has limitation, which was the small sample size, the short duration of follow-up, and some eyes didn't show obvious Schlemm's canal blood reflex in all quadrants. We thought this could be to a partial or complete Schlemm's canal collapse in these quadrants. But, however, it is possible that the difficulties in inducing blood reflex led to this phenomenon. This paper was published in 2018 in Experimental and Therapeutical Medicine. And that's all. Thank you for listening.
شكرا دكتور سمير، شكرا على المحاضرة.